Hello, everyone on YouTube. How you doing? I hope you're doing well. Okay. First one, depression. I feel depression. My opinion, I feel depression is basically just, you know, when it just get too tough to do things you do when you're not depressed. You feel hopeless, alone, sad, not wanting to do anything. I feel that if you have not tried meditation, music that you usually do that make you feel better, um, puzzles, because you're using your mind to think, arts and crafts, where you like wood or whatever the case may be. They have so many tools, different tools nowadays. You can buy it already fixed, and you can just like a little dresser. You can just sketch on it, and then get one of the little wood carving things and work. Sometimes people even actually feel better with a pet. You know, being sad and depressed and suicidal is a very big thing here in America, everywhere basically, and it will help if the meditation don't help, if the puzzles don't help, if the drawing don't help, if doing painting, sketching, things you do to make you happy. If you having that many issues, a lot of people have certain places that they use to they go to be alone, to think, and just to feel better. Some people take and go to the church. Some people go to bingo halls. It's a lot of things out there. The important thing is to figure out what can make you happy and grow on that. Thinking positive about something, not thinking negative about a lot of things. It's very important, because that little thing, even though it don't seem like much, can actually help you. And if none of that help, go to a therapist and make sure, you know, if you feel uncomfortable or you feel like they're not helping you or you feel how you feel. And keep going. If that therapist ain't helping you, like, I guess a couple months, if you don't start to feel better in a couple months, but you should feel a little release, relief, sorry, relief, when you are doing whatever you like to do. Breathing exercise, I was actually, breathing in, just sitting with incense and just a very soothing music, and just sitting there and breathing in the positive, out and blow out the negative. Just do that. It might actually help. You said it might help everyone. But I'm just telling you the tools that I have used to help me and things I have suggested to associates and friends and people I know that actually took my advice. And it helped them. And if none of that helped, maybe you do need to go to a therapist. For instance, if you're watching TV and something's talking to you, you need to go to a therapist. I don't know if you would need medicine or not. I will hope you wouldn't, because a lot of these medicines have so many side effects on them. Now, depression and bipolarness kind of seems hand in hand with they say depression to have manic episodes where you can't think and you're just doing a lot of things at once, and you just can't get it, But with that being said, you have to find the right one. Because the great therapist means a great patient. A lot of these hotlines don't do it for you. Now, some, if you just need to release, as in talking, they do have these hotlines where they won't be too mean, but some of them do. Now, I think I just spent probably 30 minutes. And I talked to 3 or 4 people. So I'm guessing the thing is I wasn't directly at risk, suicide or anything, but when a lot of stress for me, when a lot of stress built up on me, and I'm just feeling so sad and stuff. That's the main reason I called, because I wanted something that I can use to help me feel better, because in October I had death in the family. I had my aunt just died recently also. So I was feeling a little depressed. So I called this hotline and, oh God. It was like the interaction to me wasn't perfect. I mean, maybe they need to go back to school and learn some more things, but I don't think these hotlines have degrees in college for this. That's why I say I am not a therapist. I'm not a psychiatrist. I am not a motivator person. Well, the thing I do on YouTube is kind of like motivation, but it is what it is. I'm usually talking about, crimes or things that bother me that I see. Now, I had one that I talked to because it had disconnected, so I had called back and they connected me to a Los Angeles one, and the one in Los Angeles, she was like, well, or she was like, no, I'm depressed. And she's like, well, this is not the hotline for that. She's like, and then she like cut me off, and she was like, no, I'm gonna just give you a number and you could just call that. And no, I'm like, is she really yelling at me? Now, if a person called the hotline, obviously, whether they're a suicide or not, they have an issue or they want to just feel better. And I don't see what is the big deal about that. But that woman was like a little too mean, was a little harsh and mean to me. And I really did not appreciate it. And what if it was a person that called that hotline and said, oh no, I'm not suicidal. I just want to talk. I have some issues I want to talk about, and I need some advice. And that woman say, no, stop talking. Wait, stop it, and just blow that person off. I just think that's just rude and wrong for anyone to say to anyone, especially if they call any hotline where it's care for you, where it's the hotline, suicide hotline, where it's the wherever else name of the things. I don't know the direct names of them, but I'm just saying. I think I'm gonna probably find some clips that will have some numbers on it, and hopefully these numbers will probably help you out. So, with that being said, I hope like my video, like and share. I'm gonna put more clips on here that talks more about that. And y'all take it easy, be safe, and watch out for your family, and take care of yourself, because it's your main responsibility. If you don't take care of your temple and your body and your mind, things can be worse for you than anything, because you got to get your mental state quite good before you can help anyone else. Y'all take it easy, and I hope you enjoyed this video and the other clips I put on here. Thank you. Also, fair use. This is a teaching thing. Fair use.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too.
What the hell?
So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area, or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
He decided to go into Manhattan. What is bipolar depression, or bipolar disorder, rather? So bipolar disorder it's a mental illness that's classified by extreme highs and extreme lows. So much so, Kyle, that it changes your activity levels, it changes your sleep patterns, it changes the way that you think. and subsequently changes your behavior. The most important thing is that it affects your life in an incredibly negative way, right? Now, there's various levels of bipolar disorder and different types of bipolar disorder, so it's very, very important to understand the different types.
Okay, let's go through those types. I feel like everybody's heard of bipolar disorder, but not many people know that there's bipolar 1 and bipolar 2. Let's start with bipolar 1.
Absolutely right. So let's start with bipolar 1 because that is just such a significant illness, right? So bipolar 1, again, what we're going to talk about, I'm going to make this as easy as possible for everyone to understand. Bipolar 1 is mania. That's the word of the day with bipolar 1. We're going to focus on the manic symptoms, okay? So bipolar 1 is this, and this is per the DSM-5. Bipolar 1 is expansive, elevated mood, sometimes irritable, right, for 7 days or more, right? And that's important. The time and the intensity are important. 7 days or more with symptoms of that elevated, expansive mood most of the day, every day for 7 days or more, right? Now, there's a list of elevated, expansive symptoms, and those are important because you need at least 3 of those for that 7-day period. And those are this: distractibility, okay? This is somebody that cannot sit still, they can't pay attention at all, they can't finish any tasks at all, completely distracted. Impulsivity is the next one. Impulsivity, so much so, Kyle, that you're going to do things that you are not thinking through. You're getting yourself into trouble potentially. You're just making rash, impulsive decisions. The next one is grandiosity. Grandiosity is a big one, right? Grandiosity means that you have this inflated self-worth. I've seen cases where it gets so bad into the realm of psychosis where people think they're God or they think they're a superhero. But it can be much lower as well, just feeling really, really high about yourself, right? The other thing you'll notice is flight of ideas. You may hear that term thrown out. Flight of ideas is just that. When you're listening to these people talk in a manic episode, their ideas are just flying out at you. And they're not really making a whole lot of sense. They're linear, but you'll talk to someone for 5 minutes and you would have heard like 100 different topics, right? So that's flight of ideas. You're going to see sometimes agitation or activity levels increase as well. Sleep, that's a big one. Sleep issues. Now, people with mania tend to not need sleep. All right, it's a very, very important piece. People can go with mania. I've had people come into my office or that I've seen in the hospital and say, Doc, I haven't slept in a week. No sleep, nothing.
And they're functioning.
And they're okay with it. That's the important thing. No, I'm fine. I'm totally good. So sleep issues is a really big deal. Most likely it's insomnia or decreased need for it. You just don't want it and you don't need it. And the other piece is really rapid and pressured speech. So we talked about the idea portion, which is what's in your head, but what you're seeing presented to you is very pressured speech. So I just went through about 8 or 9 things, right? You need at least 3 of those for 7 days straight, most of the day, every day, okay? That's the bulk of the criteria for mania to get a diagnosis of bipolar 1. But this is what a lot of people don't pay attention to, and this is probably some of the most important diagnostic criteria. Ready for this? And I know I love these because this is what people don't pay attention to. Number 1, it cannot be caused by a medical illness or another psychiatric issue, okay? The importance with this is that mania can be caused by so many different things. Medically, a thyroid issue can do it, traumatic brain injury can do it, temporal lobe seizures can do it. You know, all types of medical issues can do it. Medicines can do it. Corticosteroids, for example, if you have asthma and you're on a corticosteroid, it can induce mania. So you need to rule out all of these medical and medicine aspects not causing the mania, okay? Make sure it's not induced by an illicit drug. There are illicit drugs that can do this, right? Cocaine, I'll tell you what, you give somebody cocaine, they're going to present pretty damn manic, right? Mm-hmm. So you have to rule all of that out, okay? And then it can't be better defined by another mental illness. Those are super important, all right? So that's the criteria for bipolar 1. And what a lot of people misinterpret is that they think you have to have a depressive episode for a bipolar 1 diagnosis, and you don't. If you have had one manic episode in your entire life, you are bipolar 1.
Wow.
Now, I interviewed Kevin Hines, who jumped off the Golden Gate Bridge, survived, and tells his remarkable story on how he's dealt with his mental health. He has bipolar disorder, and he said in his book, Cracked But Not Broken, when he was in a manic state and not sleeping, he would start, at 17 years old, would start campaigning for presidency of the United States. And not as a joke, not because he thought it was funny or cool, because in his brain, his reality was that his next step in life was to become the president of the United States. Grandiosity. Are there examples like that that will demonstrate some of these traits that you're aware of?
Oh, yeah. It's
Bipolar disorder is a mood disorder that is characterized by alternating periods of depressive symptoms and elevated mood, termed either hypomania or mania. Most people experience normal ups and downs, but in bipolar disorder, the range of moods is greater than normal and features extremes. We'll come back to this graph, but first we need to define depressive and manic symptoms. According to the DSM-5, depressive symptoms include a low mood, anhedonia, meaning a loss of interest in previously enjoyed activities, diet or sleep disturbances, experiencing low energy levels that may even make getting out of bed too much, psychomotor retardation, feeling worthless and inappropriately guilty, and losing the ability to concentrate. In severe cases, there can also be thoughts of death and suicide. Then, there are symptoms of mania or hypomania. These are features of an abnormally elevated mood. Mania is more severe and impairs day-to-day functioning and may include psychosis, leading to a misdiagnosis of schizophrenia. The DSM-5 lists the criteria for mania as at least 3 of diminished need for sleep, a sense of grandiosity, meaning being superior or better than others, pressured speech, racing thoughts or ideas, distractibility, increased level of goal-focused activities, and excessive risky pleasurable activities like spending sprees, sex, or gambling. For mania, this must last at least 7 days and be enough to impair normal functioning or pose a threat to others. Hypomanic episodes are similar, but need only 4 days and are observable to others, but do not cause impairment in functioning. Based on these, there are 3 main types of bipolar disorder. Bipolar 1, which can be diagnosed with a single episode of mania because it is given that a depressive episode will eventually occur. Bipolar 2, where there is at least a single depressive episode and 1 hypomanic episode. Then we have cyclothymic disorder, sometimes considered as mild bipolar disorder, where there are depressive and hypomania-like episodes that do not quite meet the criteria for major depressive episodes or hypomanic episodes. Some people will fluctuate quickly between the 2 extremes, with 4 or more episodes of either mania or depression in 1 year defined as rapid alternating, while some can experience both depressive and manic symptoms at the same time. Bipolar disorder has a lifetime prevalence of around 1 to 3%, with males and females being affected approximately equally. It most commonly starts in late adolescence or early adulthood. The exact cause of bipolar disorder is not known, but it is thought that there are multiple factors. Genetically, there is a link between a family history and an increased risk of bipolar disorder, with studies quoting up to a 10x risk if a first-degree family member is affected. If one parent is affected, the likelihood of developing the disorder is 15 to 30%. However, if both parents are affected, this rises to between 50 and 75%. But this doesn't mean a family history guarantees development of bipolar disorder.
There are environmental factors, such as significant stress, like death or illness, as well as other stress factors, like relationship or financial stresses. The treatment primarily involves management of the acute phase and stabilization over the long term, as there is an increased risk of suicide in bipolar patients. Psychotherapy, including cognitive behavioral therapy, which is useful in preventing long-term relapse, is effective on depressive symptoms, and interpersonal therapy is another option. However, they have not been shown to be as effective when treating